The virus is, at the moment we speak, already present in all European member states. And therefore, that closing borders is not necessarily the best way of ensuring that we can contain further the outbreak within the European Union. But at the same time, we recognize that member states have been acting in accordance with the information that they had, and to do what they considered in the context of their responsibilities as best to protect the health of their citizens. The issue is not really at this stage what is our view on the policy. The issue is how do we ensure that, taking into account the measures which have been announced by a large group of member states, we can continue to meet the twin objective that I was describing in my introduction. That is to say, on the one hand, ensure that hospitals, health systems in general, and patients receive the support that they need, and on the other hand, that we keep essential goods flowing through the market, that is required for economy to function. Let me remind you, for example, that we have been Commissioner Breton has been working with industry over the last weeks in order to first assess the situation in Europe when it comes to the production of various types of medical supplies and how to ramp up production of these. But obviously, you need the components which are required for these equipments and supplies to be produced to be able to reach the factories where they are produced. So this is the stage we are at. Follow up.
Yes, thank you. When you say that closing borders is not necessarily the best way to contain the spread of the virus, I'm wondering, obviously now in some countries and in more and more member states, populations are sealed off to prevent the spread. And the reason being brought forward for these controls by member states is that they need to do the same at their borders to protect themselves from a further spread, from a further uncontrolled spread of the virus. So if the Commission agrees that sealing off certain high communities with high infection rates is okay, why would the Commission not consider the sealing off or reintroduction of border controls be appropriate? Thanks.
I understand the sense of a question, but it is the responsibility of member states to take such measures. We are in a very fluid context. And what we have been saying is that these measures, in order to be effective, need to be very well coordinated and implemented. But we have also been saying that governments have a responsibility to protect the health of their citizens. They are taking the measures they have taken the measures that they consider to be appropriate. We are trying to focus on our job at the moment, which is to make sure that in this context, we are doing what is necessary in order to manage the situation. All right. David.
Thanks, Eric. Just following up on the borders issues, it does leave a sense that there is not coordination, that there is a lack of control, that the President of the Commission is left to only be able to plead with capitals to not take these steps that they're supposed to first, as I understand, consult with the Commission about. So I wonder if you could address that sort of logical gap that seems to exist there between simply saying, well, we understand in this fluid situation that member states will take their own unilateral actions, and then the Commission President issuing a video statement saying such unilateral actions aren't helpful, and this sense that the core gravity of the EU is not holding because the member states are acting in a crisis all on their own.
You know, when you are in such a situation, you need to decide what you're going to focus on. Do you focus on trying to say, hold on a minute, are we doing, have all the actors acted exactly in the way we would have wished them to at a given point in time? Or do you stay focused on what is it you do vis-a-vis a developing situation in order to ensure that things improve? Quite frankly, David, we are entirely focused on the second. Why? Because the amount of things that need to be done is extremely high. The means that people have in order to achieve this are hampered by the situation, and therefore we are focused on that. But let me remind you at the same time that we have put in place daily phone calls, video conferences that the Commission is organizing. Therefore, member states are talking to each other as much as they are talking to us, and that this is a situation which will continue to develop, and that hopefully, with the presentation of the guidelines that is coming today, we will be able to improve the coordination as time goes by. Have things been perfect from day one? Obviously not. Do we hope that based on the day-to-day impact of the closures, member states understand that it is in their interest to work with each other and with us in order to have a coherent approach that allows everyone that is in need of receiving medical supplies to receive them, or factories that need to receive components to receive them, or shops that need to receive goods to receive them? We certainly hope so. Catherine.